Hi, my legal name is Rodney, but I go by also. And so, my clinical question that I was answering is, how can nurses make smoking cessation a reality? My initial concept map that you guys will see on the discussion post had 4 reasons why individuals may fall into a smoking addiction. In Jeanette's article published in 2021, said individuals may not be educated or knowledgeable about the risk of smoking. Wallace posted in his article published in 2021 stated that the disadvantaged population have no access to better alternatives to relieve stress, and he also stated that they use it as a stress reliever even though it's a poor coping mechanism. Rigodi published in their 2022 article that patients may already be addicted to nicotine and have a hard time quitting the learned behavior. So this clinical question is important to address because CDC states that cigarette smoking remains the leading cause of preventable disease, disability, and death in the United States. Cigarette smoking accounts for more than 480,000 deaths every year. Tackling this issue would help patients live much healthier and possibly longer lives. So I chose the Watson's grand theory of caring with a transpersonal approach. This theory has a unique ability to provide quality care on a deeper level, and I believe this is what this specific patient population needs. A nurse would really be able to bond with the patient, properly educate the patient of the risks of smoking, and help instill faith/hope in the patient to make this big change within their life. And I think this is key, is instilling hope and faith. That sets this theory apart from other theories because, many theories have implementing a authentic therapeutic relationship and a trusting, caring relationship and teaching and promoting health. But instilling hope and faith is big, and having the patient believe that they can actually change for the better and overcome their health obstacles so that they can change. So, I'll discuss my final theory conceptual map that you guys will see in the discussion post. So first, the nurse will gain knowledge on and how to implement Watson's 10 curative factors, create a healthy environment, and remember to leave room for divine moments. The nurse will then build an authentic therapeutic relationship and use love, care, compassion, and knowledge to explain the risks of smoking. This will lead to the caring for the patient's mind, body, and soul. So the patient will be having their mind, body, and soul taken care of when this happens. And depending on the situation with the patient, the nurse will use one or all interventions in order to also care for the patient's mind, body, and soul. So these interventions include brief advice that Garcia Gomez talks about in the research article published in 2019, individual counseling by Lancaster and instead our research article published in 2018, and behavioral therapy with pharmacological therapy posted by Swar in his research article published in 2020. So this will lead the patient to understanding how to use healthy coping mechanisms to relieve stress instead of smoking, be properly educated on risk of smoking, and find healthier alternatives. So my anticipated outcome is to help guide the patient to make healthier decisions, having healthier habits, and increase wellness in their mind, body, and soul. Ultimately, I believe this will lead to the patient. Ultimately, this will lead to the patient to quit smoking for good, and I believe that this can be done with a proper interventions, with instilling hope and faith, with building that trusting relationship, the trusting therapeutic, authentic relationship, and properly educating the patient and really seeing what the root is. Once you figure out what the root is and assess the root of the patient, I believe you can definitely treat the patient and give them the proper interventions to overcome this. So what I want you guys to take away from this is that 12 out of 100 adults currently smoke. And if we can get to the root cause of why they smoke, we can have a better success rate at getting them to quit. This all starts with developing a helping/trusting relationship, as I talked about, promoting teaching/learning, and instilling hope and faith. Applying these actions in our practice can not only help improve patient outcomes with patients who smoke, but any other kind of patient population.